Bleeding and spotting from the vagina during pregnancy are common. If bleeding is heavy during pregnancy, it's always medically emergency. But most cases spotting is relatively harmless. We will discuss most common causes of vaginal bleeding during pregnancy. Almost 25% of pregnant women have bleeding episode or spotting during her pregnancy. Spotting means light bleeding. When blood spots are on underwear, but not visible bleeding. Bleeding is more serious than spotting. Bleeding is when you need pad to keep the blood from soaking your underwear and clothes. Bleeding or spotting at first trimester of pregnancy. Spotting or bleeding is common at first trimester and it's relatively benign. Causes include implantation bleeding, when a fertilized egg or embryo attaches to the uterus and begins to grow, it can cause bleeding. Sometimes women think it's their period. Implantation bleeding happens 10 to 14 days after conceiving a baby. In many cases, it matches period time. It's an early sign of pregnancy. It's not dangerous, and you don't need treatment. Implantation bleeding is not heavy bleeding. Having sex can also cause light bleeding or spotting during pregnancy. Sexually transmitted diseases like trichomoniasis can also cause bleeding or spotting. Miscarriage. Miscarriage is when a baby dies in the womb before 20 weeks of pregnancy. About 15% of known pregnancies end during the first few months. Most women bleed and cramp afterward. But also almost all women have spotting and bleeding before miscarriage also. Causes of bleeding later in pregnancy. Having sex is common cause spotting or light bleeding. Medical manipulations such as internal exam by gynecologist can cause some bleeding or spotting. Problems with the cervix can cause bleeding including infection, growths, inflammation or cervical insufficiency, or when a woman's cervix opens too early. Bleeding or spotting later in pregnancy can be more serious and needs more medical attention. More serious causes include preterm labor. This is labor that happens too early, before 37 weeks of pregnancy. Placenta previa. When the placenta completely or partially covers the opening of the uterus, cervix. Placenta accreta. Occurs when the placenta grows too deeply into the uterine wall. Placental abruption. This is when the placenta separates from the wall of the uterus before birth. Uterine rupture. It happens very rarely. And it happens in women who have scar in the uterus from a prior cesarean birth. In most cases spotting is not caused by serious problem and its treatment is just rest. Sometimes take time off from work and stay off your feet for a little while. Don't have sex, douche or use tampons. Heavy bleeding sometimes needs hospital stay or surgery.